Those on the front lines who keep us safe in emergencies say they are reaching a crisis point in Wisconsin.
That's right. EMS workers say due to lower volunteer numbers, higher call volume, and increased medical costs, they need something to change. Armand Rahman reports.
That is their fourth call today. Really? And it's noon.
Petrona EMS hit 5,100 calls last year for the 3 ambulances that cover Fitchburg and the city and town of Verona. They're on track to hit 5,900 calls 6 months into this year.
It's about 25 to 30 times a month where all of our ambulances out. And then we're at that 45 times a year. So it's about 3 to 4 times a month where somebody else has to come in and cover our territory because we have no more ambulances.
Other smaller rural EMS agencies are facing that without the staff to keep up.
The state that we're currently in is not the best.
EMS chiefs are hoping 3 assembly bills currently in the legislature could address that. One would allow an exemption to the municipal tax levy limit for any costs associated with regional EMS services.
Right now we have the municipality alone, that city alone, funding 100% of their EMS. And any increases in EMS would have to be funded by that tax levy limit.
Another would require Wisconsin's technical college system to provide grants for EMS courses. And the third would raise the maximum reimbursement services can get for Medicare and Medicaid.
Increasing that Medicaid reimbursement is going to be huge for us. Our Medicaid reimbursement on that $1,500 bill is about $100. The rest of it is written off.
Belleville EMS covers 5 municipalities. Chief Chris Backus says while they're fully staffed right now, that could change soon.
Sharing the staffing models and staffing personnel too. If we can kind of open up our borders per se and help our neighbors down in Brooklyn staff or help our neighbors down in New Glarus or Monroe.
Both chiefs say without help like these bills,
the funding's going to have to come from somewhere or you're going to wait longer for an ambulance.
Reporting in Verona and Belleville, Armand Rahman, News 3 Now.
Armand, thank you. And according to the Wisconsin Policy Forum and the Wisconsin Office of Rural Health, 41% of EMS agencies statewide reported they had parts of their schedule where they did not have adequate staffing to respond to a request for an ambulance.